The Clinical Compass is sponsored in part by True North Medical Care.
Hello, everyone, and welcome to the Clinical Compass, where we navigate healthcare through truth and expertise. My name is Chad Stencil. I'm a family nurse practitioner and the host of the Clinical Compass. Today, we have a very special guest on, and her name is Dr. Vera Prisacari, and she's a board-certified psychiatrist.
Hi, thank you
welcome.
so much for having me.
Yes, thank you. Why don't you start by just telling our viewers a little bit about yourself and what you do?
Well, thank you so much for inviting me. Like you said, my name is Dr. Prisacari. I'm a board-certified adult psychiatrist, but my passion is truly ADHD. So I founded ADHD Alliance of Minnesota. It's a private practice right here in Edina. And I see clients ages 18 to 60, anyone on their journey of finding out if they have ADHD or if they've already been diagnosed, getting the treatment for it. So anything from diagnosis to treatment, medication management.
Perfect. So can you tell our viewers a little bit about what ADHD is?
That's a really good question. There's so much in the media these days. Everybody wants to be an expert. It stands for attention deficit hyperactivity disorder, but the presentation really varies. Some people will have all the inattention symptoms and no hyperactivity at all. And those tend to be the people that get missed in childhood. They'll come in later in life saying, why am I having so much problems at work? Spacing out during a conversation, my spouse is getting on me, why am I not paying attention? Why am I forgetting important things? It doesn't seem like anybody else is struggling with this. Why is it just me? What did I miss? And then we delve deeper into it. It turns out it's ADHD. It's a disorder that starts in childhood. So there's no magical age when you'll see it first, but usually before the age of 6, you'll start to see some symptoms. People struggle in elementary school, middle school. And sometimes if you have really good structure at home with parents, it can get missed. It'll get overlooked. I was just talking to somebody earlier this week. They had really good counselors and good teachers that helped them succeed in high school, went on to college. And it wasn't until they were in professional school, in law school, that they actually were like, oh my goodness, I had all of these people helping me out that were essentially my executive assistants, and now I have to do it by myself, and I just do not function like that. So we go into it, we look at the symptoms, and it's ADHD.
Awesome. I'm glad that you do that work because I think ADHD is a common medical problem, correct?
Yeah, the estimates vary, but somewhere between 6 to 7% of the world's population have some ADHD symptoms of presentation.
Okay.
Now, not everybody needs to be diagnosed. Some people do really well never seeing a doctor. They just know that the symptoms are there, it runs in their family, and they function fine.
Okay.
So we're looking at how much is it impairing your life? What's the functional impairment?
Okay.
And there's different aspects to it too. You got work, you got home life, social life, so things you do for fun, and academics. So across those different spheres, where are the impairments? If there's no impairments, it's not a disorder.
Gotcha. And so you said earlier that you specialize in people ages 18 to 60.
Yes.
I just want to tell our viewers, is there a reason why you don't see people over the age of 60 and why you don't see people under the age of 18? Is it specialized in training, or is it just a preference, or is it harder to treat those age groups?
Yeah, so the two extremes, right?
Yeah.
So the very young, ages under 18, so it's pediatric, right? Child and adolescent psychiatry is its own fellowship.
Gotcha.
So there's additional training that goes into it. And I really respect my colleagues that go through that additional training, and they have more knowledge, more skill, more intricate work that they do.
Gotcha.
It's not just the same medications at a different dose. There's actually a lot more complexity to it. The young brain is still developing. The symptoms are presenting differently. There's other things you need to watch out for. So I leave that for the child and adolescent trained psychiatrist.
Okay.
And then on the other extreme, over the age of 60 is where we're starting to see more cognitive decline. So there's more
Gotcha.
concern from memory loss and early onset dementia, which can sometimes look like ADHD. You're forgetful, you're inattentive, you're missing important tasks, your daily functioning is maybe declining. And because that overlap is really serious, again, as a psychiatrist, I'm like, you need to see a neurologist, you need to see a full team of specialists, maybe have an MRI or a PET scan done of your brain. So there's more complexities with older age. But for adults, we can really get a clear picture without any additional scans like that.
Sure, sure. No, I'm glad you explained that in great detail. Let's talk a little bit about how a patient, would get diagnosed with ADHD. What kind of testing is there? Who do they need to see? Can you speak to that a little bit?
Yeah, there's so much out there.
Sure.
And it can be really hard to parse through. I've had patients tell me that they do late night Googling and they'll schedule an appointment with me at 2:00 in the morning. I see the timestamp on it. I'm like, yes, I know you were doing your research on your laptop. Well, let's start first with what is required.
Sure.
So it can be as simple as doing a questionnaire in your doctor's office.
Okay.
It can be a little bit more complex to that. You can have additional questionnaires from your parents and your teachers, especially for our pediatric population. So they're called Vanderbilt. Those are standardized scales that are sent out to parents and teachers, and then the clinician will kind of interpret them. Then you have the other extreme of being really thorough neuropsychological testing, or neuropsych testing for short. This is performed by trained neuropsychologists. So they're PhD level clinicians, and they'll spend anywhere from 5 to 8 hours with you. This is a really intense test.
Yeah.
And they're not just looking at ADHD. Now, their panel includes everything from PTSD or trauma-related disorders, anxiety, depression. They'll be looking for traits of autism or learning disabilities. It's very comprehensive.
Gotcha. Okay.
But because that takes such a long time, and the report writing takes a big chunk of their time as well, those can be really expensive.
I
Here
bet.
in the Twin Cities area, that can range anywhere from like $2,000 to $5,000.
Oh, wow. Okay. And so, for instance, in my clinic, if I had a patient that comes in and I think they have ADHD, I could refer that patient to you.
Mm-hmm.
They would make an appointment online. And then what kind of testing do you do in your clinic?
Yeah. So I specialize in ADHD. So all of my testing is very specific to that.
Okay.
And I kind of think of it as two buckets. It's either ADHD or it's everything else.
Okay.
Now, because it's not a full neuropsych testing and I can focus in on just ADHD, it doesn't take that long. It's not a 5-hour test. In fact, the appointment with me, that initial intake is only 1 hour.
Okay.
So a lot of people will kind of question the quality of that. They'll say, how can you get so much done? How can you really have an accurate diagnosis in just an hour? But the answer to that is I actually do a lot of the prep work before the appointment even starts.
Okay.
We start with a 10-day symptom log. I ask any prospective patient or client, write down what's bothering you. And you don't have to know if it's ADHD or not. Just give me examples of your real life. Where is the issue? Where's the impairment? Are you losing your keys? Are you forgetting to lock your door? Are you missing track of your calendar? Are you forgetting important appointments and showing up late? Or are you just forgetting to eat? Where's the distractibility? Where's the impairment? Is it at home, at work, both, all of the above?
Sure.
Track it for 10 days. Give me a comprehensive list. Again, this is even before we have the appointment.
Okay.
I also offer a continuous performance test, or CPT. This is a 20-minute online ADHD test. It doesn't need verbal or language skills. You're not talking. It's just your focus and attention on a pretty boring and very uninteresting test on a laptop from home. So make sure, again, that there's no distractions, that you have the time allowed for it, but it gives us data. It's a way to have a number to how quickly are you responding to stimuli on a computer for consecutive amount of time for 20 minutes.
Okay.
So it's another way that we look at distractibility, inattention, impulsivity. And then the final component, then when we do meet in person for that hour appointment, then is the synthesis, or kind of putting all those puzzle pieces together.
Okay.
So there's a lot that goes into it.
Yeah.
A symptom log, a continuous performance test, and the in-person appointment. And I'm looking specifically at ADHD symptoms, function impairment, and deciding, is this ADHD or no?
Okay.
And if it's not, it's something else that I say, we have the answer. We've answered the original question. Is it ADHD? And if it's not, unfortunately, I'm not the specialist for you to see. And I give resources and referrals to colleagues in the community. So it's really exciting that you get a clear answer before you walk out the door.
That's great. So it sounds like you spend a lot of time with some prep work, have the patient fill out some paperwork, some different tests, and then when they come in, they get a very comprehensive exam, so to speak. You go over all of the information and can tell very much whether or not they have ADHD or some other psychiatric condition.
Yeah.
And then if they do, then you would refer them to a different specialist that can handle that.
Absolutely. And it's not because I'm not trained. I have the training of an adult psychiatrist, board certified. So can I treat anxiety and depression? Of course. And that's something that I did in my previous position.
Sure.
But it's not what I enjoy doing, and it's not what my private practice is set up to serve. So I really want to focus on the ADHD symptoms. I can identify if this is something else, and I can make those specific referrals.
Awesome. Well, thank you so much. We're going to take a short break, and we will be right back.
Enhance. 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 Too much. Unenhance.
Guys, it doesn't have to be this hard. If you want to watch Town Square television programs, just go to townsquare.tv/streaming to find Town Square's community programs in your city or school board meetings. Or look for the Cablecast app on your smart device and search Town Square Television.
At True North Medical Care, care is in the name. True North is proud to provide personalized, evidence-based medical care designed to help you feel your best. Offering in-person appointments in Edina and virtual visits to meet you wherever you're at. True North Medical Care and family nurse practitioner Chad Stencil are here to help you empower your healthcare journey. More information can be found at truenorthmedicalcare.org.
If you're reaching for the moon with your video goals, but it's driving you bananas trying to get there, we can be your guiding star. Whether it be for marketing, storytelling, preserving memories, or just getting your message out there, Town Square Television's Production Services Department can help bring your ideas to life. For more information or to ask about a custom quote, you can visit townsquare.tv/production services.
Hello, everyone, and welcome back to the Clinical Compass. Before break, we were discussing ADHD and what that diagnosis meant and how to get diagnosed with that illness. Now we're going to move further into signs and symptoms of ADHD. Can you speak to a little bit of the symptoms that we may see in children versus adults?
Yeah, so that's a really great question. I think the classic symptoms of hyperactivity were based on the model of an 8-year-old boy that's causing a big disruption in class.
In school.
Yeah, but the way it presents now, it can be very different than that. So it's not just somebody that speaks out of turn or gets up out of their seats or goes to play with somebody else's toys, because in today's world, technology is such a big component of it too. It could be somebody that's not paying attention to a video lecture, right? So we have remote learning.
Yeah.
It could be somebody that's not paying attention to when their spouse is talking. So if you're looking at differences between kids and adults, in kids, a lot of the time of that dysfunction or that friction of you're messing up or you're really missing something comes from academics. So school is a major factor. But in adults, it's a little bit more self-directed because adults will either have an issue at their place of employment, so they'll kind of have a talking to with their boss that they're on performance improvement plan, or from their spouse. They'll be, hey, you're not pulling your weight anymore around the house. What's going on? And it has to be that insight from the person themselves to say, I'm seeing multiple people coming to me and telling me that there's an issue. So then they do more digging. And that's why the diagnosis usually is kind of like self-awareness is first, and then they reach out to a professional.
Sure.
But the inattention hyperactivity symptoms can be a little bit different in adults.
Okay.
They can be stuck on the social media loop of their screen time. They're just swiping on videos. They can't break that loop. They can't get in to take a shower. They can be really hard to that behavioral activation to get started on a task. They can have time blindness, which is where you don't realize how long a minute is or an hour. You either have the sense of it's now or not now. Okay. It can be hard to plan for events. I had somebody give me the example of, I always thought that the difference between like sitting at my desk at home and then driving somewhere was 0 minutes. But in fact, when I timed it, it's like 7 or 9 minutes. I have to close my laptop, pack my bag, put on my shoes, grab my keys, phone, wallet, start my car, open the garage, back out the driveway. Wow, that took 9 minutes. And no wonder you're running late, because the ADHD brain is just wired differently. You don't recognize the amount of time something's going to take, that executive function of time management, planning, being organized. In kids, yeah, you forgot to do your homework. In adults, it could be like you forgot to file your taxes.
Okay. So in children, we hear these stories like the small child is looking out the window. Yeah. That's not necessarily a sign of ADHD, but if there's other things that are with that, it's probably best to, again, see a professional and see if they truly have ADHD or something else is going on. And then adults, can this affect job performance and work-related issues?
Absolutely.
Okay.
At work, it shows up as missing important meetings,
Okay.
Being present in a meeting, but forgetting to pay attention or take notes or recognize to-do lists or tasks to accomplish after the meeting. It could actually show up as missed opportunities or missed promotions.
Okay.
People with ADHD tend to not advance as far in their career as those that are without ADHD, which kind of is, you're missing out on finances, like a promotion, a bigger paycheck. You can see that academically as dropping out of college or changing your major so many different times that it sets you back on graduation. It's again costing you more money, but it's costing you time. Okay. You can be changing jobs or quitting jobs abruptly. That's the impulsivity part of ADHD as well. When I get to know my patients, there's a bunch of examples, and it's so fascinating to hear about it. But the number one remark that I hear at the end of an ADHD diagnosis is, I wish I got this diagnosed earlier.
Sure.
I wish somebody would have told me sooner.
Yeah, because it does affect so many aspects of life, right?
They see it in their kids. The kids get diagnosed and treated, and they see how much better their academic performance becomes. So then the parents with now newly diagnosed ADHD come back and they wonder, how much further would I have been able to go in my career?
Yeah.
How much better of a parent would I have been had I got this diagnosis and got it treated sooner?
Yeah, no, so it sounds like there's a magnitude of symptoms. And so the best thing is to go see somebody if you're having certain symptoms or possible symptoms of ADHD. So the next topic that we should talk with our viewers about is, who do you go see? So do you see your primary care provider? Do you see a psychiatrist that specializes in this? Like, what would you recommend a person do if they have symptoms of ADHD, or a child or a younger person, 18-year-old, something like that?
100%. This is a really great question because there's so many different providers out there, right? Clinicians. And amount of their expertise and comfort with prescribing different medications varies. I would say always a good place to start is the clinician that you trust the most. So usually that's a pediatrician or family doctor, your primary care professional. The credentials there, it vary. It could be an MD, DO, it could be a nurse practitioner or PA. Anyone that you've already had an established relationship with that has seen you for other medical conditions, that's a great person to start with. Just voice your concerns and tell them, I'm looking to get more evaluation or look into this further. What are the next steps?
Sure.
Sometimes because of insurance requirements, you need referrals, or there's certain providers that are in network or out of network. It gets complex really fast, but it's always really helpful when you have somebody on your side that knows you, that could help walk you through that process.
Perfect. And I'm glad you said that. So our viewers can just understand that you can really go to anybody that's in the healthcare field. And if they feel that they need further testing, or if they need to send to a psychiatrist or neuropsychiatric testing that you brought up before, they can certainly do that. And sometimes insurance will dictate that they have to do that.
Yeah, and it's a way to triage. In medicine, we talk about that. They like the severity of the symptoms and how much evaluation or testing is needed afterwards. Now, if you have a primary care doctor that loves treating ADHD and they're very comfortable with it, have a lot of training, and they're going to do it well, you are in luck. You are one of the few lucky ones that can kind of talk about your symptoms and get the treatment right away.
Perfect.
Unfortunately, a lot of people don't have that experience, and they get referrals, or they see somebody that's doesn't want to treat ADHD, doesn't want to talk about it,
Sure.
and they get another referral, or they
Okay.
get another, maybe, I'm not sure, come back and see us later, or I don't know what you're describing, and you sense that hesitancy. They don't walk away from that appointment with any clear answers.
With any clear answers. So then, okay, we have a patient, comes to you, is diagnosed, and fits the criteria of ADHD. What kind of treatment options are out there?
Yeah, one of the best things about treating ADHD and why I love it so much is because the medications work so well. Without going into all of the intricate details, we have stimulants and non-stimulants. A lot of people have probably heard of medications like Adderall, Ritalin, or Vyvanse. There's a lot of differences between them, but the similarities are that they work for ADHD. So medications-wise, they work fast. They work the same day you take them. And if you're having side effects, you can switch. There's lots of different options. There's different doses, and there's so much good clinical research that we know it's evidence-based. We're using science here. We're not just guessing.
Yeah.
And I love when patients come back and they tell me they had immediate improvement. The noise in their head went down. It felt like 100 tabs closed and just you had one. There was no longer that radio or that noise in the background. You're not just writing a to-do list and losing it. You're actually checking things off. And that's so satisfying, and it makes me feel so happy that I'm making a difference in their lives.
And so I really want to emphasize that because other psychiatric medications don't work that fast, right? They take weeks or even months to build up. If they work. But these types of medications for ADHD, as soon as you take them, they do work pretty quick. People notice a difference.
Same day.
Yeah. So it's actually pretty fast.
So it could be a couple hours. And they do come with their own side effects that you need to talk to your medical professional about. But if you find the right one and it works really great, it could be a stable medication regimen that you stay on for years.
And if you get the right medication and you prescribe it, these patients, because a lot of these medications are controlled substances, right? Mm-hmm. How often do they have to follow up with you to get those medications?
My guidelines are pretty strict. I like to see everybody once a month to make sure that they're taking the medication, that they're having the desired effect, and that they're not experiencing any side effects.
Gotcha.
It is a controlled medication because there is the potential of it having bad outcomes.
Gotcha.
So I want to make sure that my patients are doing well.
Well, and then other than medications, are there therapies or different things that can be done as an adjunct with medications?
I absolutely, yes. And I am only a part of the bigger picture. My medications really, the practice of medication management is super helpful, but it's not the full scope. There's lots of really good things out there that are not medications only.
Okay.
So one of the ones I recommend is CBT, or
Okay.
cognitive behavioral therapy, specifically for ADHD. It's evidence-based. It has lots of good research backing it up. So there's specific skills that somebody with ADHD can train their brain and their environment. If somebody's interested in doing ADHD skills-based training, there's lots of other professionals too in the area, whether they're therapists, coaches, tutors. There's lots of member directories online as well to find them. But do your research. Find somebody that's knowledgeable, that has the training for it. Don't just pick the first one
that you find. Thank you so much for joining us today on the Clinical Compass. Please stick around for the credits where I will be giving you a tip on how to control anxiety at home. Hello everyone. Before you go, today's episode we talked about ADHD, which can bring about anxiety and racing thoughts. I'm going to give you 2 tips on how to help those racing thoughts and anxiety. One is temperature control. And what I mean by that is you can use an ice pack or a piece of ice and apply that directly to your neck, your armpit, or your groin, and that helps break that cycle of racing thoughts or anxiety. The other tip is to use sour candy. It can be any sour candy, lemon drops, warhead candy, anything that's sour, and you're gonna put that directly in your mouth, and that sour taste will actually distract your brain and break that anxiety or racing thought loop.